Hi there, my name is Luann Wisher, and I'm going to be telling you about my teaching plan that I'm going to be teaching women's services nurses. And it's about teaching them about a treatment plan for a mom who has or who gets candida or a yeast infection on her nipples. So that's what we're going to be talking about. So 10 groups of 5 or so nurses will be taught this learning session. The session will be taught by a lactation consultant. The nurses will be involved on the discussion. Quizzes are taken amongst the group. To generate a discussion in the introduction part of the lesson, some questions that might be asked would be, how many of you are aware that breastfeeding mothers can get a candida infection on her nipples, and do you know what the treatment plan might be for this mom? Number 2 is, how many of you are aware of the 10 steps to successful breastfeeding, and can you tell me about step 3? Discussion of the information about Memorial Hermann Northeast goal toward baby-friendly designation and the importance of 10 steps to successful breastfeeding will occur. Handouts and flyers will be distributed. Discussion of the information on the flyers, such as a treatment plan for the mother who has a candida infection on her nipples, will be discussed. A 2-minute video will be watched called Vasospasm in Breastfeeding. There'll be a post-assessment quiz, and then there will be questions and answers at the end of the lesson. So understanding goals, women's services nurses will understand that informing mothers about ways to prevent candida and understanding the treatment plan assists the mother in meeting her breastfeeding goal, informs the mother about treatment options for candida infection, prevents the mother and infant from having further complications and cessation of breastfeeding caused by the candida infection. So some objectives are women's services nurses will state common subjective and objective findings associated with candida, discuss the etiology, incidence, and risks associated with candida, discuss pharmacological treatment options for candida infection, and if, when, and how fluconazole should be used, develop a plan for evidence-based management for the candida infection. So we have our case study here. This is a 32-year-old female, 10 weeks postpartum. She has been exclusively breastfeeding. She recently took amoxicillin for a sinus infection. She has a red, shiny area around her nipple. She states, I have a deep burning pain within my breasts after I feed my baby. She states, I have been to a lactation consultant and the baby has a good latch when feeding. And upon assessment of the infant has white patches on the tongue and inner cheeks. So Candida species are a part of the normal microbial flora of the human gut, but when opportunity arises, this organism can overgrow and results in an infection process called a yeast infection on the mother's nipples, and then also the yeast infection occurs inside the baby's mouth, and that's called thrush. So presuming that nipple or breast pain is due to Candida albicans has resulted in an overuse of systemic antifungal therapy in many patients. So for patients, this has led to adverse drug reactions and antifungal resistance. So therefore, diagnosing a yeast infection on mother's nipples is a very complex process in which completing a detailed patient history is a necessity in this case. So some predisposing or risk factors for this mom. For the mother, if there's been a recent use of certain medications such as antibiotics, birth control pills, or anything with cortisone or steroids, cracked or damaged nipples, vaginal infections, diabetes, a weak immune system, a diet that's very high in sugar and yeast and low in vitamins and minerals. And then some risk factors for the infant might be use of a bottle nipple or a pacifier, or even use of artificial infant formula. So in the case of a breastfeeding mother, if Candida is causing an infection of the nipples, and especially if it is difficult to treat or keeps returning after adequate treatment, there is definitely an underlying problem. And that underlying problem is almost always damage to the nipple caused by the baby's latch and the baby not latching onto the breast well when feeding. So some typical symptoms that occur is nipple pain that begins after a period of pain-free nursing, burning nipple pain that continues throughout the feeding, sometimes continuing after the feeding is over, pain in the breast that is shooting or burning in nature, which goes through the mother's back and even her shoulder. So Treatment for yeast on the nipples is the first line of treatment is something called all-purpose nipple ointment. So this is a compounded ointment mixture from mupirosone 2% ointment and betamethasone 0.1% ointment. It is sometimes mixed with an antifungal miconazole 2% powder or fluconazole 2% powder. The ointment is applied sparingly after each feeding and not wiped off, but allowed to soak into the breast tissue. The ointment is used until the patient is pain-free for a few days, and then you decrease frequency for a few days until it's stopped. So next, after you tell the patient to start the all-purpose nipple ointment, the next thing she should use is grapefruit seed extract. So this should be used in conjunction with the all-purpose nipple ointment. 5 to 10 drops is mixed in 1 ounce of water, and then the cotton swab is swabbed inside into the mixture, and then the mixture is swabbed onto mom's breasts. After each feeding, the patient will let it dry for a few seconds and then apply the all-purpose nipple ointment. She will use this until her pain is gone and then wean down slowly over the period of at least a week. Okay, so then we look at oral grapefruit seed extract, and this may be used if the pain is not getting better. So the lactating mother will take 250 milligram tablets 3 to 4 times per day. And also it's good to tell her to take a probiotic as well. So she should take 1 to 2 capsules 2 to 3 times per day, and the probiotic should be taken at least 1 hour apart from the oral grapefruit seed extract. There is something else called gentian violet. This is a 1% water-based solution that should be applied to the inside of the baby's mouth before latching the infant onto the breast, and this is done 1 feeding per day for a period of about 4 to 7 days. So this should be stopped in 7 days, whether the patient is better or not. Gentian violet is safe for the breastfeeding mom and baby. However, in rare cases, it can cause some irritation inside the baby's mouth. So if this happens, treatment should be stopped immediately and the healthcare provider should be contacted. Gentian violet is a deep purple color, so it will stain skin and clothing. A good response to gentian violet confirms that the mother's nipple pain is caused by candida, since little else will respond to gentian violet. So this also justifies the use of our last resort medication, which is called fluconazole. So fluconazole does tend to work best when used in conjunction with probiotics and oral grapefruit seed extract. It is an antifungal agent that is taken systemically, and this stops the fungi from multiplying, but it doesn't actually kill it. So this accounts for the fact that sometimes it takes several days before it starts working. So the patient will be prescribed a loading dose of about 400 milligrams fluconazole, and then the patient should take 100 milligrams twice daily for at least 2 weeks, or until the mother is pain-free for at least a week. So fluconazole should not be used as first-line treatment, especially if the mother has sore nipples. It's important, again, to take a complete history and to assess what the cause of the sore nipples may be first. So fluconazole may take 3 to 4 days, and in some cases up to 10 days before it begins working. If the mother has not had any relief within 10 days of her taking fluconazole, it's very unlikely that it will work, and she should stop taking it. The cost of fluconazole is around $300 to $350 for a 2-week prescription, but now there is a generic fluconazole available, which is less expensive. So some side effects to fluconazole. It usually is very well tolerated, but there's no such thing as a drug that is without side effects. So normal side effects, vomiting, diarrhea, abdominal pain, and skin rashes are the most common side effects. And also, fluconazole, as far as when we think about the breastfeeding mother, it does appear in milk, in her breast milk, but it does it so it's such a low amount, like most medications. It appears as such a low amount that it's not any cause for, it doesn't cause any harm in the baby at all. So it is recommended that this mom keep breastfeeding. Okay, some preventative measures for yeast infection or candida is for mom and baby to just let them know, wash hands, wash, and wash often. Wash the breasts and nipples in the shower or the bath daily with water and soap. Wear a fresh, clean bra every day. Change nursing pads after feeding. Wash all clothing and towels that come in contact with the breast in hot water. 1 cup of bleach can be added to the wash cycle, and a cup of vinegar can be added to the rinse cycle, and this boosts the washing power. Boil anything that comes in contact with baby's mouth, pacifiers, bottle nipples, teething rings, baby's toothbrush, and medication droppers for about 20 minutes per day. And then after a week of treatment, those items need to be discarded, and the patient should purchase new ones at that point. And then just notify the mom that she needs to boil all pump parts if used in hot water for about 20 minutes every day. All right, that's the end of my lesson, and we are going to go over questions and answers at this point. Thank you very much.